I want to thank Miss Nicole for being able to share her experiences with everyone. I hope that you guys heard her story, and if you guys experience anything as if she experienced, I hope that you guys would have the courage to speak up so that people can know that you're hurting.
Yes, definitely. And stay tuned. We have part two, and that's featured with Dr. Ashley Poole, and she's a licensed professional counsel. And she's going to provide additional resources on ways to overcome insecurity. So stay tuned. Don't go anywhere.
Look forward to seeing you.
Okay, so we have our guest, Dr. Ashley Poole, and she's a licensed professional counsel. She's licensed to practice in both the state of Pennsylvania and North Carolina. Her primary interests include integrative healthcare, pain management, forensic psychology, and the impact of social media use on mental health. She currently serves as one of the interprofessional education course coordinator at Philadelphia College at Osteopathic Medicine. She presented at national and regional conferences as a mental health advocate, as well as developing webinars of emotional well-being. So today we have Dr. Ashley Poole.
Welcome.
Welcome.
Thank you. It's great to be here. I got to get used to being called doctor because it was May 29th when I defended. That was the first time. So yeah, just transitioning from therapist to I have on my black psychologist shirt today. So
Like that.
Congratulations, though.
Thank you so much. Thank you. It's definitely been a journey. So I know all about insecurities.
Yeah, so we love to hear about your tips and pointers and resources with insecurity and how to overcome of it.
Absolutely. And so I definitely can give those, but to give context, like with insecurity, what definition do you all like think of? Just like self-doubt, like a person that's not comfortable with themselves, with insecurity, because when I think of insecurity, it usually is like it could be a symptom of something else. So it could be like a symptom of depression. It could be a symptom of anxiety if we look at it as a symptom of like a bigger picture. But just generally speaking, I think all people have insecurities where they may, feel less comfortable or experience some kind of doubt about themselves. I found the definition just for context, so we're all on the same page. And it just says like emotional insecurity or simple insecurity is a feeling of general unease or nervousness that may be triggered by perceiving of oneself to be vulnerable or inferior in some way, or a sense of vulnerability or instability which threatens one's self-image or ego.
Right.
Think about insecurity, like you could be insecure about applying for a promotion at a job because maybe it's like, oh, so-and-so more qualified than me. I'm not so qualified for that. Or if you're in a relationship with someone and like they are super attractive, all of the women want them, you may start to feel insecure about your placement in their life and if it's going to be sustainable. So just generally defining insecurity is something that we all can probably relate to, but in terms of like how it impacts our life, I think is what I really wanted to kind of give more pointers to today.
Great. We love to hear those tips and pointers.
Absolutely. So first off, I would say really exploring what it is that you're insecure about. So like, like sometimes a person can just be identified, oh, it's so-and-so is insecure, but it's usually specific situations in which that insecurity manifests. And it's usually associated with where, our values stand. And so like with me, a value of mine is achievement.
Right.
So anytime I'm in a position of, like achievement, my insecurities start to fly. When I was applying to the doctoral program, when I was getting ready to defend, because I value it so much. Not so, I value relationships, but I wouldn't say that my insecurity has transitioned as much in my love life as it has in my personal, like academic life. So one pointer is to kind of identify where you notice different situations in which you feel most insecure.
Mm-hmm.
And I would challenge people to think about, like, what are you thinking about? Oftentimes it goes back to the definition, your perception. So it's not that it's true, because it wasn't true that, I wasn't going to ever make it into a doctoral program. There were some things I needed to get my GRE score together. I needed to, get letters of recommendation. I just needed to put a plan in place. But first I had to figure out what thoughts was I having that was making me feel insecure. Insecurity could be more of a feeling than it is a fact. But sometimes we think our feelings they're real and valid, but they're not always based on, accurate thoughts, if that makes sense.
Right.
So the first thing I would encourage people to do is what are you insecure about? Think about, like, what am I thinking in this situation? Am I thinking I'm not qualified? Am I thinking I'm not pretty enough? Am I thinking I don't look like Beyonce, and Beyonce is the queen bee and she's the standard of beauty?
Yeah.
I would encourage a person to really sit and examine their thoughts, because thoughts and feelings are different. So I feel nervous, I feel anxious, but it's based on what I'm thinking. And that's thinking I'm not qualified, or he's going to leave me, or I'm not going to be that great. I don't, people say this about me. It's all about what we're thinking.
Yes.
Can you all relate to those?
Definitely, you're right. Because I have to say it's always like a mind thing, because like you have that mindset where you see people like greater and better than you feel like you can't compete or fit in.
Exactly. Exactly. And those will all go in the thinking category. So my thought is I'm not as attractive. My thought is I can't compete. And sometimes when we narrate, and honestly, I practice this still. One thing that my program taught me, so I was trained in CBT, which stands for cognitive behavioral therapy. And one thing that is really big in cognitive behavioral therapy is identifying thinking patterns. And so sometimes we'll say, I felt disrespected, or I felt like you was trying to play me, or I felt like you weren't going to promote me. None of those are feelings. You can't feel like someone isn't going to promote you. You can think they're not going to promote you, and that can cause you to feel sad or uncomfortable, but you can't feel that, because feeling words are sad, overwhelmed, frustrated, angry. Those are all feelings. And so I always encourage people, again, going back to the tips, to separate your feelings and emotions from your actual thoughts, because you can't change your feeling per se, but you could change the way you think about it. Because if it's the same situation in which you have a boss that really doesn't like you, and it seems like they want their best friend to be promoted, if your thought is, well, my boss doesn't like me, but I'm qualified, then that leads to a different feeling than if you're only thinking, my boss doesn't like me, they're not gonna pick me, So I would encourage a person to think about what their thoughts are in those situations. Another tip is talking with someone. So utilizing your resources.
Right.
Oftentimes we have friends that now you got to choose the right friend.
Yeah.
Right friend here.
That does make a difference.
Yes. Because they can give you like tips and pointers based on what they experience, and it could be something from insecurity.
Because I have my days, and Tracy be like, no, we'll pray together. We'll take a day trip somewhere, and it helps. You need that support.
Because you have to clear your mind, because you have all these thoughts like in different scenarios playing in your mind.
Absolutely. Yeah. So it's super important. So definitely utilize your resources. So that would be step 2, is utilizing your resources, but also recognizing who's going to be more of a resource and who's not going to be a resource. Because granted, our friends may have our best interests at heart, but they may not give us what we need in that moment. Like you said, you can talk to Tracy and she can say, okay, like, let's go on a trip, or she can give you what you need in that moment. Because sometimes people will give us stuff to be more insecure about.
That's true. Yeah.
You sitting there like, she don't like you, so you might as well quit. And you're like, dang, well, can we problem solve a little bit more? So utilize resources, whatever those resources are. So definitely relationships and friendships would be one. Another resource that I would encourage people to utilize is the internet. Now, I don't recommend the internet for like therapy or for like diagnosis and clinical stuff, but in terms of finding resources that you could use for self-help, the internet is good for that. So maybe you'll find like a support group. Hi, Brittany. Hey, how are you? Maybe you can find like, a support group of like, whatever you identify as, like Black women achievers, or strong Black women, or, like Black girl magic, whatever that resource is to kind of feed you and provide you with some positive reinforcement. So I would say utilizing resources, and also use yourself as a resource. Sometimes, journaling, like just exercise, and there's so many resources that you can do to like clear your own head so that you can come up with like a next plan and step. I always recommend therapy. So I have a shirt that says, if you have a goal you want to reach, therapy can help. Because oftentimes people think, oh, I don't need to go to no therapist. And I'm like, I do work with people that are crazy because I've worked in a psychiatric hospital. But most of the people I work with are successful professionals that just, like I work with millionaires that purchase franchises. And before they get ready to purchase a franchise, they're like, I'm anxious. What if it doesn't do well? What if it's
right?
And they just want to talk to somebody to ensure that they've considered everything. So definitely using therapy as a resource. If your insecurity you think it may be linked to something else, like such as a symptom of depression or a symptom of anxiety or a bigger picture, like if utilizing yourself, your friends is still like not enough and you're feeling distressed, then I encourage people to look at therapy as a resource.
Definitely.
Yeah. And then like a third and final resource that I kind of encourage people is what in CBT we call behavioral activation.
Okay.
So what behavioral activation simply means is being active, like doing things. So again, if we go back to my original statement about like insecurity and the definition of it, it typically stems from thoughts, like thoughts that, people don't like me, people are judging me, I don't like myself, I'm not enough, the thinking patterns. So it's like, well, what will it take to be enough? So I started to experience insecurities when, like I was living in Fayetteville. Like I said, I definitely was working in mental health. So I love what I was doing, but my thoughts were, I'm not reaching my full potential. I could be doing more, like you're supposed to be a Black psychologist. Like I had all of these thoughts. And if I look at behavioral activation, it was like, well, what do you need to do, Ashley, to change some of these thoughts? And what I needed to do was I needed to try to go back to school and become a psychologist. So behavioral activation just means examining your life, examining yourself, those negative thoughts, and seeing what you need to put in place. So like, let's say that, like I'm insecure about my body, like, and I love snacking, y'all. So I got a little
I do too, girl. Yes.
I don't have, no washboard down there. I mean, it ain't like, I don't look pregnant, but I look a little, you could squeeze something down there.
Yeah.
So it's like, on one hand, I can constantly criticize myself and become self-conscious about that, or I can do something about it, which is what I'm doing. Since the pandemic has been happening, I've been running every day. I've been trying to look at different things I can replace more sugary foods with and eat more healthy. So that's where the behavioral activation comes into play, is that you don't deem yourself helpless because of your insecurities. You empower yourself as to say, like, so my stomach may never be flat, but it's flatter than it was before the pandemic started. You know what I'm saying? So I'm feeling good about that. And then with behavioral activation, this is like one of the most important things I encourage people to do, is to not compare yourself to anybody else. Because so there's two types of comparison, like that we use in psychology with behavior. So there's upward social comparison or comparison. So like if I compare myself to like, let's say a Beyonce or somebody regular, let's say one of my line sisters that's got like this banging body, that's upward social comparison, because I'm looking at someone who I deem is like better or has the best figure, and I'm comparing myself to them and, really putting myself down. But then there's also kind of like more of a downward social, in which, you look at something, well, at least I ain't so-and-so, like, but both of those can sometimes prevent you from actually moving forward and doing something, because now you're not setting your own personal goal. You're looking at what they doing, and you're not doing anything. So with behavioral activation, it really personalizes it to say, like, what do I need to do? Like I said, I knew I needed to apply to a doctoral program. I knew I wanted to get out of Fayetteville so I could start dating more. I looked at what behaviors I needed to feel more confident in myself. And I will say, like, the first year I moved to Philly, I dated more guys than I probably had my whole last 4 years in Fayetteville, because I had made a decision to act and to get out of my thoughts, if that kind of like makes sense of how your thoughts can really get in the way of things. Any questions or feedback?
And we have Nicole, she just tuned in. Did you have any questions for Dr. Poole?
I don't know. She touched so much.
Yeah.
I'm just taking what she said and run with it. Like, that's awesome. Like, I don't know. What would you recommend someone that has insecure dealing with? Cause see, okay, my whole thought process is insecure. Like, I'm unsure about everything. I'm talking about everything. So I think it's more like health thing, mental.
Well, girl, we all are the same. It's mental with us all.
I'm talking about I am unsure. And I just want to be sure about everything, if that makes sense.
Yeah, no, it does. But honestly, so not saying that you have anxiety, but a person like with with generalized anxiety, they tend to feel anxious about most things because it's, like this idea of, wanting to have the perfect next step, like you said, kind of being unsure. So there's a worksheet that I utilize, and it's called like a thinking errors worksheet, and it just basically looks at ways that most people think that get in the way of actually doing. Because like, let's say that my thought was, you're not gonna get into no program, you're gonna waste your money, that's really, like the plan. So I don't know why you're gonna waste your time. I wouldn't have did anything. When you're feeling anxious, it either one supports avoidance, so you don't do things, or sometimes it may cause you to be like impulsive. And so I would encourage you to kind of like reflect on like what your goal is, you know what I'm saying? And then become more goal oriented, because I'm indecisive, like, so I want to normalize it. I want to say like, okay, you indecisive too. I really want to normalize what we're all experiencing, which is like thoughts. So how many thoughts y'all think the average person has in one day?
A whole lot.
You just had to guess a number. Everybody
I'm gonna guess maybe 40 to 50 thoughts.
I do that in an hour.
Okay.
She does. She really does.
Everybody give a number.
Listen, I don't even know the number that I'm thinking, because like my mind races. It races so much. I think about getting medicine. Like, it won't stop. Like, if your mind's supposed to be going 1 mile per hour, I'm at 1 million. Like,
so you would say 1 million thoughts a day? Okay. What was yours? So we got 1,000,000, 50, and what was the third one?
No, mine was 50 an hour. I just said 24 hours.
Okay, so I'm gonna tell y'all for time's sake. So the average person has between 65 to 80,000 thoughts in one day.
Wow.
So listen, and that's just the average person. So you take someone that tends to be like more anxious, or someone that like has a job in which they're like constantly being like pulled in different directions. So like you said, our thoughts are happening so fast, we don't even remember everything that we're thinking because they happen so fast.
Okay.
Like it's just like thought. Thoughts are really like one analogy that I heard at a conference is it said like thoughts are like emails. And so you think about it, you have several folders. You have your inbox and you have your spam. Mm-hmm. So I would encourage anyone with insecure thoughts to put those insecure thoughts in their spam. They still coming. It's not to say that I don't wake up some mornings and I'm like, dang, like, like what are you doing? Like, was this, I still think sometimes, was this moving to Philly, pursuing my doctoral program? I'm about to graduate next month and I still have thoughts sometimes like, was this what I was supposed to do? Was this the best decision? So I'm not ever saying that there's any like medication or life thing that makes the thoughts stop. You just learn how to manage them. Because stuff that come in y'all spam, do y'all even look in there?
Look at it, tell you the truth.
Oh, exactly.
I don't.
Exactly. You go to your inbox where the important stuff is. And so the important thoughts are going to be the ones that tell you, you can do this, you can overcome, you can set goals and reach them. You are more powerful than you have ever been. You cannot be indecisive. You can make a choice to do those things. You just have to give more importance to those thoughts than you do those ones that are more debilitating, that kind of tell you the things you can't do and that you should be critical of yourself.
Right. I agree with that. I never thought it'd be that many thoughts that run through your mind.
And I promise you, man.
And then we Black women, you know, so let me bring in culture because that's very relevant. And I've done research on, you know, like African American women, and especially like our health disparities, and we don't need, this is a whole different topic, but just generally speaking, when it comes to like health conditions, we're like at the bottom of the pole for most things. And when I say at the bottom of the pole, meaning we have greater complications for most things. Childbirth, when it comes to mental health, our symptomology is going to be more severe. We tend to be like more critical of our like sleep, like everything. We have a lot of work to do, we as a whole. So I highlight that just to say that, you know, it is helpful for us to be mindful of, one, how powerful our thoughts are, and two, how mental health impacts our physical health. So if you having 65 to 80 thoughts, 80,000 thoughts a day, and let me add this too, the majority are going to be negative.
Mhm.
It's natural to be negative. You really have to be positive on purpose. So that's one reason that it's so important to have your tribe, your resources, and yourself, and really to pour into that because of how, you know, genetically we're made up. So like I said, when y'all told me y'all was doing this, I was so excited because I was hoping that everybody would be able to be transparent, give real life examples, and really instill hope, if not into, you know, the greater us four. Like I'm, you know,
Yes.
feeling good just connected with y'all.
Yes. And this is a topic that we want to discuss because a lot of individuals do suffer from insecurity in the workplace, culture, and our environment, our family, relationships, and social media and everything.
Absolutely.
And it makes you wonder, I mean, we run across so many females who have the same similarities, and it makes you wonder, where did this come from? Where did it start from? Is this something that's hereditary? You know, is this something just like you mentioned, like with the culture? Is this something that, is it because we see, you know, we're visual individuals where we, you know, we see stuff on social media, we spend more time watching other people.
Mhm.
It's almost like you getting sidetracked instead of focusing on yourself, you're worrying about everything that you see and that you come across and
Absolutely.
what you hear.
Absolutely.
And I know sometimes with me, I have my days where I try to tune out everything. I put my phone away. I just cut me on some music, some positive, inspirational music, and my day ended up feeling a lot better.
Yeah. No, you're absolutely right. So where it comes from is all of the above, really all of the above. And so, you know, family is, you know, probably the first introduction to like how we think about things,
Mhm.
you know, oftentimes. So if you grow up around a family that's, you know, telling you that, you know, you Black in America, you're gonna have to work twice as hard, or you know, you dark skin, or you know, like you know, like it just different things that people give us to think earlier in our development really do follow us throughout life. Like our experiences shape us. Like I know transitioning to being natural, like I was a little insecure about what people thinking about this. So I
Yes.
keep me, you know, a little track for some, you
Close
know,
by.
ponytail. Listen, and I go back and forth. I go back and forth from some days you'll see me with a 18, 20-inch sew-in, and some days you'll see me with like a bun, but I still don't wear my hair. Like even when I wear my hair natural, I have a fake bun, and I have enough hair that I could wear it, but I'm just not comfortable yet. Like I'm looking like, that's not cute. It wasn't until the pandemic that I really started to play around with it and put a little curl thing in there. See, oh, you got a little wave, you know, Ash, you can rock your, you know, your old stuff. And having other people pour into me like, I want to see your hair like this. And my fiance, he's giving me compliments, but you know, these thoughts definitely come from all of those places. So from childhood and what, you know, your parents taught you, to when you first started to have a crush on whoever you crushing on, whether it's males or females, and seeing what they were attracted to. Like I grew up when Maya was the Maya and you know, like T Chili, and I don't have hair like Chili. She was brown, so you know, it felt good to see a brown girl up there, but my hair was not like that. So it really looks, it's so many factors that, as you stated, it makes sense that disconnecting from that and being able to just kind of like look and appreciate yourself, it can reinforce more positivity. And that's that's no shade to anybody, because, you know, being Black is a spectrum in terms of what beauty is and how people see it. It's just that, you know, what you tell yourself. If you tell yourself that this person is the standard and you don't look like the standard, you got to think what other thoughts that would lead to.
That is so true.
Absolutely.
And that does play a lot in like the media and entertainment, where we see like the Beyoncés or like the Gabrielle Unions, how they look beautiful, and then they see a lot of guys admiring their beauty, and then it makes like some women feel insecure within, that they have to abandon their own individuality of who they are just to fit in their role, just to dress like them, look like them, or talk like them.
And you know what's funny with that? Because they have art, you know, they have people stylists, they have people dressing them, telling them what they need to eat. I mean, working out, all of that. We live our day-to-day lives. They pay people to meal prep and do everything for, you know, for them. But if they take their hair out, just like,
and then most of the times they airbrush Chanel on the magazine. Let's be real.
Exactly. If we had a personal chef, somebody could cook tofu and make it taste like ribeye, you know, or somebody could take some organic sweet potatoes and make them taste like my grandma made, you know, like they do have the resources again, you know, so you got to think about all of that. And now with the surgery, you know, no shade, but so many people on social media will post these bodies, and it's like, you know, eating pizza and saying the tea did it. That was not tea, okay? That got your body looking like this Fashion Nova model. You definitely went to go see Dr. Miami, which is no issue, but I can't compare my body and running around Philly to Dr. Miami's work. It's gonna look different.
Exactly. And even I was gonna say, even with social media, they see how people post like pictures of them with vehicles and like the money and going on trips, and then in reality, they may not have all that. They just maybe, you know, they going through insecurity themselves and maybe trying to feel accepted by like the in crowd.
Yeah, I was thinking about that too. I was gonna say probably the average person who we see that we think they have it going on, money, everything, they're same situations. Low self-esteem, insecure. We've seen many people commit suicide. I mean, millionaires. So that lets you know it's something that's internal.
Yes, definitely.
Absolutely. Absolutely. And from the outside looking in, you can't always know what a person is thinking or feeling. Absolutely, because we have seen people that you look at and you think that, I would like their life, or they got it going, everybody loves them, but you know, internally they're going through some things. That's why I said it's at the first step, you have to see if your insecurity is just the general insecurity that, you know, anyone would tend to have whenever they're in a situation that may be like a new situation or make them uncomfortable, or if it's connected to depression or anxiety. And I really, really want to underscore that, because there are so many individuals, mainly, you know, in the minority community, that are not recognizing their symptoms to be associated with something. You know, like, I mean, it's like, you know, people wait until they have an ulcer before they go for stress, or till they losing weight. Stomach fat is heavily associated with, you know, stress. And so a lot of times it's not that you're not working out or that you're not eating, it's just that you're not managing your mental health. So I encourage everyone to really recognize what, if there's symptomology, if it doesn't lift, or you still feeling this nervousness ongoing, it could be a greater issue than just, oh, I'm feeling insecure about this situation. So definitely checking with your resources and talking to someone could be useful.
And you know what, Dr. Poole, when you mentioned stomach too, it made me think about food. But I've noticed too, certain food can trigger your emotions, and you know, I mean, I've noticed when I eat fruit, whatever, it's like whatever you put in your system, in your body, that's how, you know, you react. It can change your emotions, just the way that you react and everything. Because they say you are what you eat.
Yeah. Did y'all watch What the Hell?
That made me become a vegan. I'm serious. I was a vegan for a year, and now I'm just a pescatarian this year too. Yeah, just from watching that, because it made you you know, think about when I watched that show, I went in my refrigerator and started trashing out meat, everything that I pretty much had, milk, everything.
Mm-hmm. Absolutely. That stuff definitely, and especially with children. My fiance has a daughter and she's 9, and I've been reading just how impactful like the food is, especially on children. Growing up, I used to be upset that I didn't have more snacks. Now that I'm older, I appreciate that my grandparents, we grew watermelons. I'm from Kinston, so you know that's the country. So we grew our own fruits and vegetables. And back then I wanted to go to McDonald's and I wanted to eat this and that processed food. Fast forward 2020, grandma, thank you, granddad.
Exactly. And especially when you go off to college, you miss that home cooked meal.
Hello.
Exactly.
And that makes you want to just think about like our great grandparents and their parents, how long they lived. Now the people, look, they checking out in their 50s from health issues. When we had grandparents living 80s, 90 years old from the food that they were consuming. So that food plays a role too in our health and mental.
Absolutely.
Absolutely.
Yeah, thank you. We'd like to thank you for taking the time to join us
and
share the insightful information.
Absolutely. I definitely appreciate it. So I'll text, well, I think you have my email address, Tracy, but if I can send anybody any resources, I'm telling you. So it's 3 levels of care. I'll close out with that, right? So the 3 levels of care. So level 1, self-help. So what the 3 levels of care means is that basically whatever we're going through, whether it's insecurities, weight loss, whatever, most people can manage these issues by themselves. So level 1 is self-help. So that's where I'm going to exercise. That's where people are going to go watch these webinars or any type of resources that you all put out. It's what we do on our own, journaling. It's going and joining the church. All of those are level 1. Level 2 are going to be your resources. So your friendships, your family, those are going to be people that you trust. Now, with level 2, they don't necessarily have to know what they're helping you with. So like, let's say I'm in a bad mood because I failed a test or an exam. I may tell, my line sister, Tiffany, and I might not tell her. I mean, I would because I would tell her. But let's say I was just calm, but like, it's been a rough day. I just need to do something. Talking to her will just soothe me. So she don't know I failed the test. Just talking to her and saying, well, you're going to get past it. You doing what you was called to do. You want to pray about it. But she's just a resource for me. So that's level 2, where you access your friends and family and other trusted people for support. And level 3 care is going to be where you hire someone. So if you hire a personal trainer or you go see your primary care about medication, or you go see a therapist, those are going to be the 3 levels of care. But just reminding people that most people will be okay at level 1. So I add that to say, if I can email anybody any resources or like worksheets, a lot of the worksheets, you look at them and it's like, oh, like it help everything make sense. Definitely access me and I will make that available.
Yes, most definitely.
Okay. I'm gonna need a resource sheet.
Okay. I got you.
And we'll put your information. We make sure we share your information.
Perfect. Yep. I got a professional Facebook and people can check in up there and I will send what I need to send because we're going to do what we need to do. Okay.
Yes.
All right.
All right.
Thank you. Thank you, Nicole.
Thank you. Bye-bye.
Thank you guys so much.
Thanks for tuning in.
And also don't forget to subscribe on YouTube at
Up and Personal with Courtney and Tracy.